Hi Wesley, it's good to see you again. I understand you're having some tummy pain today. Can you tell me when it started?
A day ago, maybe.
Okay. Has it gotten any worse?
Maybe a bit.
Okay. Where's it located at?
Somewhere here.
Okay. Have you ever had this pain before?
No.
Okay. You tried taking anything to see if it would help?
I took something. I don't remember what.
Maybe some Tylenol, some ibuprofen. Nothing's working. Is it the worst pain you've ever felt before?
No.
Okay, but it still feels pretty bad, right? A little bit of a temperature. Okay. Any diarrhea? Constipation? Okay. Any history of rectal bleeding or anything like that? Okay, well let's go ahead and take a look. What I'm going to look at here is I'm just going to look at his tummy. I'm looking for scars, lesions, moles, anything suspicious. Don't see anything like that on him. He looks pretty good. You can see sometimes waves of peristalsis in people with an obstruction, and I don't see anything like that. So I'm going to go ahead and take a listen to him. His stomach is flat. Don't see any asymmetrical regions or anything like that. I'm going to take a listen over the aorta. Listening for any bruits. Sounds good. Going to listen over the renal arteries. Any bruits. Listen over the iliac arteries. Good. And then if this was an actual patient, I would actually be able to assess the femoral arteries a lot better, but we're going to pretend. Okay. And I'm going to percuss the belly. Sounds good. And then I'm going to percuss for liver dullness. Right there. And if I wanted to, I could go all the way up. And I could actually measure the span of the liver. Okay. I think I forgot to listen for the belly sounds. Might want to do that, especially before I started tapping. So then I would start the percussion and I would tap the 4 quadrants, measure the liver span, and then I would want to lightly palpate and watch his face for areas of tenderness. And if this was appendicitis, he would have some tenderness here. He's going to pretend he's not going to pretend with me at all. So I would check rebound tenderness. You could check Robson's sign. I'm going to palpate those inguinal lymph nodes. You could do a deeper palpation. Feeling for masses or organs that are swollen or anything like that. And then to feel for the liver edge, take a deep breath in and let it out. Okay. And then to feel for the spleen, same thing. Deep breath in and let it out. Okay. Alright. And then we'll do the Murphy sign. And take a deep breath in for me and let it out. You'd be watching for the inspiration to stop with that if he was having any gallbladder issues. So, looks like we're going to pretend that Wesley is having some signs of appendicitis, some rebound tenderness, pain located in that right quadrant. To assess further for that, we would do the Zoas sign. Alright, Wesley, push back against my hand. No, other way. Push back this way. Push against this hand. Okay, and if this was positive for appendicitis, he would be complaining of pain. You can also assess it by doing this, the obturator sign. Relax your leg, Wesley. And when you would internally rotate the hip, he would have pain. Alright, so we're going to assume that some of these appendicitis symptoms and signs and tests are positive. So we would do a CBC, we'd send him for an ultrasound. If he was coming into the office and I really felt that it was appendicitis, I personally would refer him to the emergency room, and they would be the ones getting the CBC, the ultrasound, the CT scan, and possibly doing surgery, laparoscopic surgery to assess for that appendicitis. Got any questions, Wesley? All right.